everyone, we're back again with another episode of this collab between Mike and Christopher here at the 2025 HIMSS conference, and we've got an amazing guest here to chat with us about his company and the platform, Michael Meucci. Michael Meucci, I apologize.
Very good.
Well, thank you. Excited to learn more about Arcadia and the work that you're doing there, and what you're looking for out of the whole HIMSS conference itself.
Yeah, happy to share. So I guess like starting off, I'm Michael Meucci. I'm the co-founder and CEO of Arcadia. We are a data platform servicing payers, providers, and life sciences organizations. Been in the business for 15 plus years, focused on bringing together first-party data sets. So you take the data that our customers, Cleveland Clinic, Intermountain, Vanderbilt have, bring that together, create a single view of their organization, and then wrapping around that outside-in data that we assemble from large-scale public data sets. So we really are the only data platform in the marketplace that is focused on creating that two-sided view, your inside view, how do you perform based on your own data, and how are you performing based on outside-in data, and that allowing our customers to build better network strategies, better population health strategies, and better ultimate care protocol strategies.
Absolutely, I got lots of questions for you.
But
I'll let you start.
This is great. This is kind of an early, but hearing you're a co-founder, can you just share a little bit of that founder story? We love startups. Not too much.
I think it's like one part good ideas, one part ignorance, one part good luck, and you don't know what you're getting into when you do this. But we, my CTO and I, we found a business that was a professional services business. We landed there. We said we think we can take this intellectual property that they were developing, implementing EMRs, implementing claims processing systems, and make something way better of it. So we took that and we built our first version of our gateway product, which is how you get data from all over the health system. It's the front door, and that was in 2009, 2010 when meaningful use was the talk of this conference.
Absolutely.
There's a fun idea there. It's go back for the last 20 years. What was the buzz topic at every HIMSS?
I know exactly.
Because it's so. You think I can't believe there was a conference where all we were talking about was meaningful use.
Or blockchain.
Oh my God, yeah. I haven't heard that more than 2 years.
Exactly, right?
I guess that's crypto.
Right.
But it was how do you bring together data, and then you start to build these big data sets, and then value-based care kind of really started to take hold in 2012, 2013, and that was a real accelerant for our business because it drove a hunger and a need for data. And ultimately we've had the same North Star for 15 years, which is create solutions that are valuable for our customers, that deliver real ROI, create solutions that are consumer focused and simple, and do that safely and securely. And by kind of using that as our guiding principles for the business of data will change healthcare. Our mission is we unlock healthcare data so that our customers can change healthcare. And just knowing our place in that ecosystem as an enabler and accelerant to help some of the best health systems, the best health plans in the country become even better.
Absolutely.
That partnership has been great.
No, that's great. As you were describing the platform and the technology, the fact that you're helping to curate data that's being collected internally, but also getting insights from data that you're gathering externally, I'm curious about the governance component of this, specifically the external data, and making sure you're managing hallucinations, anomalies, how you're ensuring that data has a level of efficacy as you compare it to the internal data that you're collecting.
Yeah, it's actually, you're hitting on a very important topic of governance, which we were talking about a little bit before the show, a different governance topic, but governance is a really core component of how we think about the world. We were talking about infrastructure governance, in this world of AI, just because AI can do something doesn't need to.
That's
AI is expensive.
Oh, it is.
And how do you manage cloud costs and all that? Yeah. But on data governance, I think what's really important is no matter what data set we're interacting with, whether it's a customer's Epic data or Aetna's claims data or CMS's master claims data set that we access through the VRDC, the CMS VRDC, which is one of the outside-in data sets, is making sure that every time we touch that data, testing for the recency, the completeness, the missingness of those data, and those are like pretty common data governance concepts that we test for. And then making sure that every data set is flowing through the same engines. So if we're going to calculate a utilization per K rate, we're doing it using the same code regardless of the data input. So that there's not a different definition of utilization from your outside in versus your inside out. And that's like a challenging concept sometimes because some of the outside data sets, they don't let you see the underlying data.
I was going to say, it doesn't necessarily match with the internal data, right? So how are you aggregating that in a way when you get that kind of one-to-one analysis?
What we do is we will only run one-to-one analyses when we have parity in inputs. So like there are certain insights we can say, hey, this is a directional benchmark for like episode cost or quality, but we don't have the underlying raw data, so it's an approximation, and we have to flag that as such. And then these are the ones where we say, we see the underlying claims data or the underlying clinical data, and we know that this utilization rate or this quality score is exactly calculated with the same types of inputs. So you can use it as a one-to-one benchmark.
Sure. So the other question I have, healthcare has been an industry that's not always been friendly about sharing data.
No.
Right? Especially between competing health systems and competing provider payers. How are you bridging that gap?
Well, it's a complicated topic. So my chief strategy officer is like one of the foremost experts on interoperability in the country, Anish Chopra.
Oh yeah.
So we acquired Anish's company last summer, and Anish and I have spent countless hours thinking about this exact problem.
Exactly.
I'm going to say there's two swim lanes we play in. First, since starting the company, it's been really important to us that we serve both payers and providers. We have been a unifier of those two sides to be a neutral third party to bring together their data sets. And we've done that for a decade plus.
That's great.
That's hard. It requires sometimes getting punched in the face by both sides and being the person who takes the punches.
That's right. You guys are Switzerland, right?
Yeah, exactly. And sometimes Switzerland gets beat up.
That's right.
But overall, through the course of time, Switzerland has become a great nation for being neutral. So I think neutrality is really important.
Exactly.
The second piece is there is a massive, for the last decade, there's been a bunch of federal intervention through both Democrats and Republicans. They may have a little bit different views of how to effectuate data sharing, but overall there's a belief that healthcare data should be freer flowing, more easily accessible for the appropriate use cases, whether it's treatment or payment or operations. And in partnership with Anish and the Care Journey team, we've enabled inbound and outbound fire servers to make data liquidity much more actionable.
Exactly.
And we're, as an example, we're one of the largest consumers of the beneficiary claims data access API, which is one of CMS's data exchange pathways. And that's helping get data from CMS to our customers faster. And at the same time, we're focused on working with a lot of our provider customers to get their payer partners clinical data faster to support better quality measurement, better utilization management. And so we view ourselves as an enabler to unlock that. But we take security, privacy, and firewalling very, very seriously because if a customer says they don't want to share their data, that's their prerogative. We're there to enable sharing when they want to. But we try and let them be the driver of that sharing.
So where are you seeing something that you're wanting to really drive this 2025 Arcadia in your strategy or some sort of initiative, anything that you'd like to share here at HIMSS?
Yeah, we announced two fun things this week. The first is a developer toolkit called our AI Factory. I led a panel at the Executive Summit on Monday.
I was there.
Oh, you were there, that's great. Yeah, Anish and Mac from SWHR. And you probably remember I talked about how over the last 18 months, trust in AI is just spiking, and I'm super excited about it. In parallel or behind that curve is AI literacy. You see people becoming super fluent, super rapidly, and they're hungry for tools. So we launched an AI Factory, which is a developer toolkit available to any of our customers who want to build in a secure environment on their own data AI solutions, whether it's generative models or agents. And so we're really excited about giving those tools to our customers with model choice, so that you're not tied to just OpenAI or just Anthropic. You have a library of models and your data in a private cloud, so you know that it's secure. So we're really excited about that because we think that's going to further drive the adoption of AI safely and securely. We also announced a partnership with League, a leading consumer a leading consumer platform in healthcare, works with a lot of health plans, and we see an opportunity for consumers to be significantly more activated in the way that they manage their care.
Right.
And we think that in partnership with League, we can take a lot of the great insights that our customers in Arcadia derive, get them in the hands of the consumer, so the consumer can be part of the care team meaningfully. So we're excited about those things. And then, really like more macro, what we're excited about with AI is this transition from software as a service to service as software. And we have 24 agents deployed in our platform and have for years in different ways, whether it's a true agentic AI or it's robotic process automation. But what I'm really focused on with all of my customers is reminding them when they buy my platform, they're augmenting their workforce with my robotic workforce. And we work 24 hours a day, 7 days a week. We don't get tired, and we're consistently enhancing that workforce and building that workforce, both through our human capital investments, but more and more through our agents. We just launched a new agent that's focused on data quality monitoring. And it used to just be that we had an alert that said data was degrading over here. Now, with a curative agent, they can say, I can fix that problem too.
Interesting.
So you've got like the two sides of the chain working together to help lift and elevate the data quality.
Absolutely.
And removing the need for human in the loop, because that slows things down.
Exactly. No,
and not
powerful.
to say we should cut the human out of the loop, because there is a great use case for human in the loop in a lot of places. But
But the real-time aspect of that is powerful.
Yeah, it's like those military vehicles that when they get a flat tire, they self-heal the tire. You don't need to pull over and change a tire.
That's right.
It's like a waste of time. We can heal your data as long as we know we can heal it safely.
No, absolutely. So I had 3 kind of rapid-fire questions.
Let's do it.
First was, how have the EHR companies been receptive to what you're doing? Because they're not traditionally organizations that want to share data. So that's one question.
Yeah, one question.
Second question, how's the patient benefiting from what you're doing?
Love that question.
As well too. And I'll hold off on the third question.
Okay. First question, rapid fire, all over the board. You have some EHR vendors who are so good to exchange data with. They have great open APIs. We have a great partnership with Athena. We've got good work with a lot of other platforms. But it's a new day. But I think through some of the policy work over the last few years, EHRs are more open than they've ever been.
Exactly.
And data coming out of EHRs.
Well, they're being mandated to be more open than they've ever been.
Right.
Okay.
And I benefit from that.
Yes.
But also, some EHRs, they're opening pathways for us to push insights back into the EMR. Ultimately creating a better collaborative ecosystem. It's all over the map. Second question: how do patients benefit? Patients benefit because at the end of the day, they need to be advocates for their own health, and they need the insights to do that. With our open data access, you can get data on your phone, you get care reminders. We're pushing insights to providers to be more proactive. Our agents are reminding providers and care teams that patients need intervention. They're telling a primary care doc when one of their patients are in the hospital so you can get better care. Our chief medical officer opens every company meeting with a patient impact story.
That's great.
And he talked about the rate of early breast cancer detection that we're helping our customers unlock, or the number of customers we're helping identify patients who are managing a condition that's undiagnosed, and we see that because we have so much data. We can say this patient is managing, PNH or PAH or another not rare but not common condition. And those are insights that otherwise would take a really long diagnostic cycle for a provider to find, and would be frustrating for a patient. We're shortening that cycle, connecting patients to treatments faster. So that to me is that's the mission. That's why we're doing this.
Wonderful.
Well, as we wrap up, anything?
Actually, I have one more question.
The third one. We didn't.
Have a third one. Third one's HIEs.
Yeah.
How are you guys partnering with them? Because part of the challenge you have with many HIEs is what's the value of connecting the health systems, investing in these platforms now, and obviously they are a conduit of collecting of data. And I'm just curious, are you guys partnering with any of those?
HIEs are accelerators for us. So in markets where there's a mature and high-functioning HIE, we say, don't go rebuild connectivity. We tap into that existing set. Sometimes we have to lift and elevate the quality data, augment it with other data sets. But if it's there, we use it.
Perfect.
We're kind of data agnostic. We'll take it from wherever we can find it.
Perfect.
It's been awesome.
This is great.
I'm excited to see what you guys are doing. Keep
Yeah.
up the great work. Keep disrupting the industry.
We're going to do what we can.
Absolutely.
We'll see you at Health or Vive or one of the next shows.
Yes, absolutely.
Thanks, guys.
Thank you.